Case number 54/2022, Saju, husband of deceased Srija versus Dr. Mridula, charged under section CRPC 304A of IPC.
Dr. Mridula, you are here. Please proceed to the witness box and take the oath.
I do swear by the name of God that I will tell only the truth, the whole truth.
Public prosecutor can start the interrogation.
Thank you, Your Honor. Dr. Mridula, I understand that you were the one who's treating this patient, right?
Yes.
And you've recorded the cause of death here as amniotic fluid embolism. Now, the textbook of labor, amniotic fluid embolism is a dreaded complication of labor. What exactly, doctor, you think are the causes for amniotic fluid embolism?
Actually, there are no established causes for amniotic fluid embolism.
Do you really mean to say that you are totally unaware of how your patient died?
No. Nothing like that. Actually, there are no established causes.
That sounds quite odd, Your Honor. Do you even remember that day?
Oh, how can I forget that day? That was a horrible day.
Somebody inform the blood bank also. Okay. What is the blood group? What is the blood group? Take over. So I am putting captain also. Okay, people that is for emergency calling. Or that is for emergency. If somebody inform the blood bank also. Okay. What is the blood group? What is the blood group? Take over. So I am putting captain also.
Actually, my patient was, that was her first pregnancy, and she was only 24 years of age. And she was admitted 1 week before her service. Actually, because her service was unfavorable, I gave her Folis, followed by misoprostol injection, and that was followed by oxytocin. During her second stage of labor, suddenly she collapsed. She had severe dyspnea, tachycardia, tachypnea, and she went into hypotension. Somehow I delivered her using a vacuum, but I couldn't save the baby. The baby was stillborn. And following that, she had severe atonic BPH, which was not responding to our medical management and other blood and blood products. Everything we tried, everything we could do to save the patient, we tried our level best, but we couldn't save her. That's what happened that day. I cannot forget that day. It was the most horrible day in my life.
I think, Your Honor, I think we need to leave all that emotional talk aside. If you look at the Williams textbook of obstetrics, that says that uterine hypertonus is associated with amniotic fluid embolism. Do you agree to that?
Yes, I agree. Uterine hypertonus is associated.
What exactly do you mean by a hypertonic uterus or a hypertonic contraction, doctor?
If the contractions last for more than 2 minutes, we call it as hypertonic contraction.
Now, I find from the case sheet that you have used a medication called misoprostol to produce labor pain. Now, what do you think are the complications of this drug?
Misoprostol can produce hypertonic contractions, fetal distress. Rarely it can produce uterine rupture also.
And you also seem to have used another drug called oxytocin. Yes. Can that also produce such strong contractions?
Yes, that can also produce.
And do you think the combined hyperstimulation of misoprostol and oxytocin put together has led to the death of this patient by hypercontraction?
No, my patient did not have any drugs were contractions. I used these drugs, but these drugs were not used simultaneously, only one after the other. So it was a slow induction. So my patient had no hypertonic contraction. Let's
come to that a little bit later. Now, how do you monitor a patient who's on an oxytocin drip?
We monitor them regularly, every 15 to 30 minutes. We look for the uterine contractions and the fetal heart rate to look for any abnormalities.
Maybe it should have been done that way. Your Honor, I want you to have a look at exhibit number 1, page number 6. And by the time our Honor looks at that, Can this hypertonic contraction cause distress to the baby, doctor?
Yes, I agree that hypertonic contractions can cause distress, but my patient, there was no hypertonic, that there was, actually I was doing a CTG also, that there was no hypertonic contraction.
How in the world can you say that? There was no monitoring as per this exhibit. There could have been some hypertonic contractions which could have been so easily missed out.
No.
And you understand that this patient was in labor for almost 3 days. Can I ask you something?
Yes.
Can prolonged labor like this, which can last for days together, can that be
Yes.
reason for bleeding after delivery?
Yes, prolonged labor can cause PPH, but my patient, she was in active labor only on the third day, last day of on the day of her death. Only that day she was in active labor. Other days she was not getting into a labor also.
Doctor, are you a member of any of the professional organizations?
Yes, I am a member of IMA, KFOG and also FOXY member.
Not just being a member, do you in fact follow their guidelines?
Yes, I do.
Your Honor, I want you to have a look at the exhibit number 2, page number 10 of the Kerala Federation of Obstetricians and Gynecologists protocol, which shows the proper way in which a pelvic finding need to be documented. And this doctor has not followed that. Now, I want to ask you that when there is a process of induction, did you take an appropriate consent from your patient?
Yes, I have taken consent, yes.
Your Honor, I want you to look at page number 12 of exhibit number 1. There is no proper consent that is taken for induction, and the patient has not been informed about the specific complications of the drug that is oxytocin, prostol as well as oxytocin. Your Honor, on the whole, I feel this doctor has induced a pregnant lady before her dates just for her own convenience, without telling anything about the complications of the drugs that you have used. And she has went on to use multiple methods, has led to such violent contractions, which has led to the complications and in fact the death of my patient. The lady was neither properly informed about what complications can happen because of the drug, nor about the routinity of the medicines that were used in here. And the doctor conveniently places a diagnosis of amniotic fluid embolism just to save herself from any legal consequences. I think she has been really careless in so many ways, not just with choosing the right drug or the method to manage her patient, as well as with the real flaws that you saw in the exhibits regarding documentation. So I humbly request, Your Honor, to give maximum punishment to the accused, as well as an appropriate compensation to the bereaved family. That's all, Your Honor. Thank you.
Now, the counsel for the defense, you can cross-examine the witness.
Thank you, Your Honor. At the outset, I want to state that my client is a doctor of good reputation. She has 23 years of specialist service in the field of obstetrics and gynecology. Moreover, whatever my friend, the public prosecutor, was trying to prove, he has failed miserably in it. And then I agree that my client had induced labor in a pregnant lady 1 week before the induction. Your Honor, I would try to bring some light into the scientific facts behind this. A fetus inside the uterus is fully grown and mature just 28 weeks of pregnancy, that is just 2 weeks before her date. And the induction was done even after that, 1 week before the date. And then some of the unexplained fetal deaths that occur inside the uterus occurs during the last 2 weeks of pregnancy. And moreover, there are scientific data, scientific reports in papers that in a properly done induction at 39 weeks can even reduce cesarean section rates. Sir, I want you to look at the exhibit on the chapter of induction of labor, page number 9. It's clearly written there about safe induction of labor before date. And Dr. Mridula, I just wasn't in the hospital certain things. Were you present in the hospital on these 3 days of induction? They said that it took 3 days for you to induce the patient.
Yes, I was present.
You were physically present?
Yes, I was in the
Okay,
hospital.
on the first day you induced her with some method? and she didn't deliver. On the second day, you could have just finished off with the labor with a cesarean section. It's a commonly done, sir. Days. It would have been more convenient for you.
No, vaginal delivery is always safer for patients than doing a cesarean. So I will always consider my patient's safety rather than my convenience.
Note this point, Your Honor. My friend was saying, the prosecutor was saying that the labor was induced for the convenience of the doctor. And waiting for 3 days is not any convenience. She actually was looking at the safety of the patient. And then another allegation made by the prosecutor was that she was not explained about the pros and cons of induction. And I want you to see the exhibits on the antenatal card and the one more on that photo. Just see, give that exhibit and see in the antenatal card. I presume the antenatal card is something that you give to the patient, recording all the findings of the pregnancy. Am I right?
Yes, we give them
But I
that
just
antenatal
want
card.
to see on that card, it is written attended antenatal classes. It's written twice. I understand that patients come to hospital for treatment, getting medicines. And what is this antenatal classes all about?
It's a practice in our hospital to give classes for these pregnant patients and their relatives. We make them aware about the whole process of pregnancy, what all problems can occur during pregnancy and during labor also.
Oh, you tell them in advance about
Yes.
what happens in labor room, delivery, how it will be?
Yes, we do.
Okay, that I can understand. But do you tell them also if labor does not come, that what are methods you do to produce pain, just like what you did in this case?
Yes, we explain to them that if they don't go into spontaneous labor, we will induce them with chance of going for induction is there and what all methods we are using and their consequences also we tell them
So
in
you would have
detail.
explained to them about the complication, then it will take so many days to maybe
Yes.
2, 3 or day. Okay, sir, it is also written in the scientific books that the best time to counsel about induction of labor is not at the time of labor but during the antenatal classes. That is a part of the respectful maternity care. Okay. And Dr. Mridula, you said you were present during the during those days of induction. Were you present at the time of delivery?
Yes, obviously I only delivered her. Yes, I was with the patient.
Okay. So when the patient, what happened during labor?
During second stage of labor, she immediately collapsed. And
Okay. So when she became, you said that she became breathless and collapsed. So that would have made you very upset. You must have been out of your mind.
No, we all have training in ORRT, that is Obstetric Rapid Response Team. We immediately started the resuscitation because the saturation was falling. I called the anesthetist also. Fortunately, he was free in the theater. He rushed to the spot and immediately intubated the patient.
I understand there were around 5 hours between the mishap and the death. And what all possible things could you have done? Were you able to manage everything your own? No,
actually a multidisciplinary team involving the cardiologist, intensivist, respiratory medicine and anesthetist was looking after the patient and I informed the superintendent also to mobilize all the supports we needed.
Okay, you said about
It was not me alone.
you were present at the time of delivery also.
Yes.
And you must have done a lot of things. And were your labor room equipped with all this? Because this is very unexpected.
We have all these things for resuscitation. We have an emergency trolley. Then we have things to manage PPH like PPH bots, transvaginal uterine artery clamps, suction catheter. All these facilities we have in our labor room.
Okay.
And moreover, one of our nurses was trained in ORRT also.
Okay. Note this point, Your Honor. A mishap had happened, but this doctor had received all the help to resuscitate the patient, and the labor room was not in short of any equipment. She had all these there. Okay. My Honor, I would like to examine one more witness in this context.
Permission granted.
Dr. Kumar Gopal, I understand that you are a senior anesthesiologist.
Yes,
How many years of service do you have in this field?
Approximately 20.
Oh, that's great. And have you seen in this 25 years, have you ever come across such cases like this?
I've seen 2 such cases.
2 such cases. Were you able to save those patients?
No, unfortunately, both succumbed to death.
Oh.
Ma'am, the amniotic fluid embolism is a dreaded complication with very high mortality. But in this particular case, we could at least do an effective resuscitation. Despite giving him all blood products and fluids, the patient developed hypotension and coagulation failure early, and hence she did not respond.
Your Honor, please note these 2 points. Amniotic fluid embolism, it's a dreaded complication, cannot be saved always. And they could resuscitate, but the patient died of the complications arising out of amniotic fluid embolism.
Your Honor, I want to cross-examine this witness. Doctor,
Yes.
I understand that you're an anesthesiologist.
Yes.
Now, if I say that this patient died of an internal injury, can you deny that?
Yes, I can deny that because no such injury occurred during the laparotomy because I was present there.
That's all, Your Honor.
It's now time for the judgment. After examining all the aspects of the case and the arguments of the learned counsel for the petitioner and the defendant, and considering the evidence deposed by the expert witness, the court unanimously arrives at the following conclusion. There is no evidence to say that there is a willful negligence on the part of the accused in treating the deceased woman during her delivery. From the available evidence, the court is of the opinion that the accused did not commit any act of omission or commission which amounts to criminal negligence. So in the verdict of Supreme Court of India, in Jacob Matthew versus State of Punjab 2005, it clearly states that there should be something more than just lack of care or error of judgment to convict a doctor on a criminal negligence.
I think the court would like to make the following observations in this context. The quality of care meted out to the patient was inadequate in more than one way. The documentation, consent, and the proper explanation of the procedure were not done in a very satisfactory manner. And the court would like to bring this to the notice of the government as well as the professional bodies that there should be a mechanism for recertification of these practitioners at least once in 5 to 10 years. Unfortunately, there is a paradoxical situation exists in our state. Even though the maternal mortality ratio is almost 1/3 of the national figures, we find that there is an increasing tendency for healthcare-related violence. Every other day, we hear about such healthcare-side vandalism, and it goes to the extent of manhandling the doctors even. And the doctors are really in distress, and there's a widespread feeling about this particular adverse effect of hospital vandalism. So the court would also like to point out that the public should refrain from violence in case of untoward treatment outcomes. The police also should ensure that adequate protection is given to the hospitals and the staff from such nefarious acts. And this particular case is dismissed henceforth, and the accused is acquitted from all the criminal proceedings in this case. And the court is adjourned for the day.
Thank you all. Thank you everyone who has participated, and thank you all.
I think it was a real eye-opening experience to witness this. I've attended court in the UK in a variety of courts, such as county courts, the Royal Courts of Justice, the highest court in the land, the Old Bailey, and coroner's courts, but nothing I don't think anything was as awful as this. Nothing personal, but you are evil. But I assume there was a true reflection of the courts in India, which I've watched some Hindi films and Hindi series, and I can recommend. I can see the resemblance. I think the issue down here, there were a couple of issues I picked up on. One, which is a big issue in the UK as well, which is consent. And personally, I always say to my trainees, a signature on a consent form is worthless, because the patient can say, well, I didn't know what I was signing. Now, I don't know what the status is in India, but I always say to my doctors or midwives or anybody, if you're discussing an issue where there's a reasonable alternative, what we call the Montgomery case in England, a ruling, you need to document it contemporaneously in the notes, what you explained, and 3 words, which is the patient understands and accepts. And if you put those 3 words contemporaneously, and I would say rather glibly that contemporaneously is before you know that something has gone wrong. So you write it, then a judge in the UK, I don't know what you would be like, but a judge in the UK would accept the doctor's view that they did explain and the patient did accept and understand. Whereas the consent form itself, you can argue, well, I didn't understand what I was signing. I think, yeah.
Now to the Montgomery principle which you said, sir. Luckily in India, sir, we don't accept that, when the court of law is not very, very pro for those things, because in a couple of cases they argued with such an argument, but they didn't work out. Secondly, in such a case, in this case, in amniotic fluid embolism, I'm sure the moment this happened, the patient relatives would have gone and given a police complaint, and the police would have come and immediately taken the files, right? It's something which happens. We'll taken the case sheet. Now, please understand that even if you have not filled the case sheet, you can always take a time of 48 hours. You can tell that I will come back and fill the case sheet. So you are not liable to give the case sheet immediately. This is a practical point which many of us miss. Please understand that you are not liable to give the case sheet immediately. You can always say, I have not filled it, because I was taking care of the resuscitation part of it, I can give it after 48 hours. So please do not be under that because what happens is many times in that fear of the police is coming and taking out the case sheet, we will fill all the forms. We may not be thinking in a proper way. So we still get about 48 hours in this case. So, madam, I'm sure that is a point which we should remember, that whenever we write a case sheet, we still have time. Yes, sir. Yes, sir. So may I request you to please come down and join us here, sir. Please. Dr. Kamapa, sir, please.
Actually, what we can do is, in the case sheet, you can write, case sheet is not complete.
Yes.
I was looking after the patient and put the time and let the police take it.
And take a thing from the police that, yes, I have received and think that the case sheet is
yes, always
complete.
you should get a receipt and a photocopy. You should keep a photocopy of that. So that in the advantage is, you can, whatever you say after that, that's the truth. But you have to write, police has taken the case sheet. I haven't completed the case sheet because I was looking after the patient. Put that time and date, of course. That will do. That's a better way than hurriedly. If you write the case sheet in a hurry, definitely you will miss some valiant points.
So exactly the point again reiterated is, take your own time in filling the case sheet once anything has happened, and you are always liable by the court or the police that you can take time. So don't be in a hurry to take that. Anything else which the...
Yeah, I think...
Yes, ma'am.
So when you write it like that, who takes which paper? Do they take the case sheet and go and you write another remaining case sheet separately?
You can give a Xerox copy, you can sign it and you can give.
But then that means there is a part of the case sheet already taken by them then.
Yes, no, madam, you write in the case sheet. Case sheet itself, police is taking the case sheet, so that I cannot complete it. Okay,
and
let them take
it to them,
let them take it. You take a photocopy and give the case sheet to the patient, police.
Oh, we have to give the case sheet to the
yes,
police?
Yes, definitely. When they ask for it, you cannot...
add on and then you write the rest.
No, you need not write. You can, so that you don't forget, you can write it down somewhere, but not in the case sheet.
Okay.
that has got double advantage.
Oh,
One
that
thing,
is it. So
in
they
a
will
hurry,
take the case sheet
if
away, but
if
you
in
must
a-
write.
if
We are
you-
always
if
under
you
the
hurry,
wrong
you-
impression that the moment the police comes, we have to give that. That is something which most of us do a mistake. So, need not worry about it. You can still get time. Secondly, again, is anything else? Rajsekaran sir, will you lead us to the questions, sir?
I think following even in a very extreme situation, I think you will get at least 30, 40 minutes before the police comes and snatches the case sheet. I think that's an adequate window period in which you can complete the case sheet in a reasonably good manner. Okay, it need not contain all the details. So I think it's always a better practice to complete it and hand it over to the police. Okay.
Sir.
Otherwise, so many other questions you will have to face in the court.
Sir, can I suggest something? I think you should declare the death only after the case sheet is complete. Would I be right in doing that?
Ma'am, in a very tight setup it will be okay, ma'am. Otherwise, there are always plug holes. A lot of plug holes in every hospital by which the news goes out, and it will unnecessarily become counterproductive, saying that you kept it for long for the sake of money, all those XYZ factors, ma'am. Because nowadays, the trust factor, the trust deficit factor is so huge. Especially in our state, we have done so much for the maternal mortality to bring down to the rate of 25 or so, and still we are liable for so much of accusations and counter accusations. It's a sad state of affairs.
Again, there is another point. You may not get time at all because sometimes when a maternal death happens, immediately violence follows. Police will be there. And they may try, we'll be trying to save ourselves, and at the same time they will ask for the case sheet. You won't get time. Any time you won't get time. But don't worry, don't forget to write it. The police, we haven't
Second thing is, as
sheet.
sir said, immediately inform the police. Even before you inform the death, inform the police that such and such a thing has happened. At least, because many a times, like in the Hindi movies or in the Malayalam movies, the police arrives at the scene very late. So at least tell them that at least such and such thing happened, at least let them come and then we have a time. In the government hospitals or the government setup, it might be a big problem, but in the private setups, it's a big problem, so we'll have to take into consideration.
Yeah.
You were suggesting.
So I just wanted to think, we are always worried about the legal consequences, and though we are worried about that, I think that always takes its own time. Now, how to prevent this manhandling of a practicing obstetrician, I think it's a primary concern. I think a day is not too far away where all of us would practice with a bouncer each, or probably the hospital will have to, if it's a group practice, hospital should have a provision to do that so that there's no attack against us. And that's why not a great idea to get into the crowd. Sometimes we get too enthusiastic. Sometimes I think we try to project ourselves in the best manner possible.
No harm or never a bad idea to run away from that.
Yeah.
Absolutely. Because however strong you are, however strong willpower you are, however physically strong you are, I think it's very difficult to handle the mob. So the doctor concerned, I think, is always better to move away from the area of this thing. I think, let's hope none of us have to face such a thing.
True. Don't get too enthusiastic. Don't try to show off how much of faithfulness you have had over the years delivering so many babies in your area, because none of that really matters for the mob. You're just a person, and according to them, you are the accused, and there's a very good chance that you get beaten up. I think that's more a logical thought process, I believe.
Yeah, I also feel you should never address the mob. I once had a very bad experience. I just went out to the theater and I faced the mob and I started talking. I did the wrong thing. So I feel the best thing to do is to take them, two important people related to the person, not the neighbor and the friend, but somebody who's in close relationship. Call them in and sit down and talk. I think because then you are the boss. So that they sit down, and I think that is the best way to counsel rather than talk in the corridors, because we have done all this in the past and faced problems.
Learned from experience, ma'am.
And I think we have some good examples from Kerala itself where doctors, after the incident, decided to stay back in the hospital itself, didn't even go home for a few days. But at the end of the day, you need to realize that they were safe, physically at least.
I agree with you, Subhash. Run away from there. Just run away. You know why? Because once they've hit you, it has already dawned on you. The best thing is, once it has happened, we cannot take it back. They may say 100 sorries to us. I feel run away through the back door.
And there's one incident which happened with a very senior Foxy practitioner, also vice president, the past vice president, Basab Mukherjee. We have had unfortunate incident where we have seen him being hit on that. So it's such a big issue. The IMA created a big ruckus, but nothing. At the end of the day, he is the one who had to bear the brunt. The other aspect is I would request all the senior practitioners here in the government sector who are all expert witnesses. That is one thing which I would always like to say is, please do remember that in a panel of 5 of you, in a panel when there are 4 of you or 5 of you, which is constituted by the government or anybody, or the medical officer, ma'am, each one of you are as powerful as the other. So please do not consider that the forensic surgeon is the more strongest of the lot and you are slightly inferior to them. Each of you, especially when it comes to maternal mortality or in terms of anything, or in terms of even the morbidity, I think your words have a lot of value. Please don't consider yourself inferior to the forensic surgeon. This is one thing I would like to say. Each one of us have equal votes. There is nothing like our vote is 0.9 and forensic is 1.1. No, we are all equal. And please assert yourself. I request all of you to please assert yourself as a senior practitioner, because it is your words which will help us out. If you are dicey here and there, I think we are the ones who will win soup.
There is another point in the expert committee panel. It should be unanimous. If it is not unanimous, of course, suppose there are 5 people. If the gynecologist says that I don't agree with you, with the forensic surgeon, she can or he can write it there. In that case, the whole thing will go to the apex committee. So it will be off their head.
To get into apex committee itself is a big thing. To get a date from apex committee is another one. And in apex committee, who are all sitting? It is all the big advocate general, director general of prosecution, somebody from the police vigilance, somebody from...
No. It is DHS, DME,
DHS, sir. DHS,
DME and DHS
Director General
vigilance.
Prosecution
And
also,
4 people, only 4 people. Only 1 person from law, all others are doctors.
Again, one more thing is, we have had a small incident once, which happened in Calicut Medical College, which happened about 5 or 6 years back. There was an expert who had put a forceps. And then the baby had a problem, and the baby died, and the baby was sent for post-mortem. And the report which was given on that was death caused due to faulty application of the forceps. Now, this is a true case. This is a true case which happened to a friend of mine. Now, tell me, with all due respects to everybody here, whether it is a faulty application of forceps, I think only the gynecologist is in a better position to say, not the forensic surgeon. With all due respect to the forensic people. Now, with such a case, it came, and that particular doctor has had an inquiry and has a lot of problems. So again, you just see from application of forceps to what has happened. So things can go wrong from anywhere to anywhere. That is the problem with all of us will have. So sometimes when you go back and see all these cases, you feel very awkward. What is there in this? But unfortunately, these are the things which have actually had a lot of problems. This is just an example which I give you. Faulty death caused due to faulty application of the forceps.
Can I just add on something? Yeah. Sorry for sounding a bit arrogant, but how in the world can an expert who has been promoted as an expert amongst us make a comment against a co-practitioner?
That happened recently, you know.
How can you even
in Cochin it happened.
How can you even think of doing that? Now, if an expert actually feels that he or she has never done anything away from the protocol, I think either you have not had enough practice, okay, or you don't know how to introspect yourself.
That's called as the holier than thou approach, as I would call it, the holier than thou approach.
We all understand that our working circumstances have been pretty much suboptimal all throughout these years. We have been overworked, we have had less working hands, and then you pass a comment about a co-practitioner that he or she has not done justice to this patient. How in the world can you do that? I think so many organizations, all of us have been working as far as possible to bring people together, not just for the fun of having to see a full house crowd on a Saturday afternoon, but I think the purpose of an organization is much beyond that. I think you seriously need to put your thinking caps on, and I think we should have a mechanism where we strongly condemn such remarks, which we are still unable to do so. We are all being very nice, and those people are not being very nice to us.
At least, see, on a lighter note, in spite of so many problems that we have had, a few problems which we have in Kerala, I think I can be rest assured to the whole of India that I think ours is an organization which is much more united, and the black sheeps in our organization, at least in Kerala Federation, I feel are very less. When it comes down to this particular aspect, I think we are all united in that aspect. Let's at least assume and request all of them, to be good to each other. That's something which I will, because compared to many other places, with no due disrespect to the rest of India, I think, again, when it comes down to litigations, I will always say, and I've learned it from somebody, I've learned it all my life, is behind every successful litigation, there is another doctor.
Yes, definitely.
Like how Dr. Shaijas actually told about hypertonicity. If you see misoprostol, then oxytocin, hypertonicity, not written in the notes. After 2 p.m., 3 p.m. was the notes written, 4 p.m. How do you expect Advocate Shaijas to know it? It is only Dr. Shaijas who knows it, not Advocate Shaijas. So somebody has taught Advocate Shaijas about these things. So do remember that all these things, again, other than orthopedics, first is orthopedics and second is gynec, which has got the maximum number of litigations. And believe me, there is somebody or the other gynecologist who is always behind this.
There is another point. This expert committee, it has got a lot of power. They have a lot of power. I will quote an example. A forgotten mop. We say that it is lex ipsa loquitur. Thing speaks for itself. But a doctor, see, it happened recently. He forgot a mop during cesarean. But on the second or third day, there was some distension problem that the doctor took a scan and found out there is something inside. And she did a relab, removed the thing. Patient is fine. Okay, that's an example. The expert committee can say, it's a human mistake, a genuine mistake that can happen to anybody who is opening up, that can happen. But she had found it in time, diagnosed it, treated it, and the patient is fine. And the expert committee can say there is no negligence. The same committee can say that there is negligence. It can go either way. They can do it either way.
Now, when you said about mobs, sir, let me take this august audience over here, that in a particular big medical college in Kerala, in the last 2 years or so, not last, I think prior to that, there were something like 5 to 6 mobs which were removed from different patients from all over the vicinity. And believe me, there is one particular senior doctor here who removed everything without a single soul outside, knowing outside the hospital. And I cannot name that madam, but that madam is in this hall right now. She is here right now.
A big clap for her, whoever that is.
Okay, with her permission, I would have said the name, but I am not very sure. But then she has removed 5 to 6 mobs without a single soul knowing outside the medical college. So hats off to such senior practitioners who have helped a lot of us.
Yeah. One more point I would like to stress is, see, when bad situations occurs in the labor, suppose a death occurred, definitely we will call the seniors, isn't it? Or the consultant. So one thing, make sure you should not shout at all. Sit and see that everything is written very well. And that is a very important point, that because the staff there or the nurses there, definitely they will go and tell the bystanders. So remain calm, do everything what is, at least when you are not able to save the patient, you save your colleague. That's a dictum of all the seniors.
Ma'am, the person whom I am referring to, that particular madam also did the same thing, ma'am. She sent everybody out and then she would remove that and then she will actually...
See, back centers we are also remote sofa, but it was not by others, even the patient also.
The final words, sir.
Thank you, Subhash, and thank you the whole team for highlighting the problems that we are facing. But don't be under the impression that the doctors who give evidence against somebody or the people who spread this, ours is a community where any patient who is affected will have a doctor or somebody as a close relative. The staff in the hospital may be there. So don't think that they are deliberately doing it. Maybe it is my own close relative who is affected. So then I will be, which side will I be? So don't expect that. Of course, we should not try to tarnish the image of any of our colleagues. I'm not saying that. But don't expect it, because these people who are saying this may be closely related to the patient who is affected. Always remember, even the walls have ears. So whenever you are gossiping or talking bad about our colleagues, that's the time when these things go around. Regarding the mop itself, please remember, forgetting a mop inside is a non-bailable offense in our country as per the rule put in by the Supreme Court. So, of course, we don't go and advertise, we don't try to punish anybody, but the seriousness of leaving a foreign body inside, that we should understand. And when you have references to some of the, I know, I understand all the cases that you are referring to, but don't be under the impression that the people who gave the adverse comment about a colleague of ours is such a bad person and all that. On the witness stand, when they are cornered by a clever advocate, sometimes you are helpless. So what we have to do is follow the principles, follow the seriousness of the situation that can happen. Let us deliberately not harm any of our friends, but all the more, let us try not to get into that situations. Whenever possible, the seniors have the responsibility to tell the juniors where these defects can occur and then take care of it. That's why I said yesterday, before you close the abdomen, you yourself have a responsibility to see that. Don't put it only on the nurse. And you yourself make it a practice and teach your juniors about it. I don't think we can say we are all on one side and the others are on the other side. Our community is such that there is nobody in our society who may not have a relative who is in the medical field who will tell them what I just found out. You know, they will be able to tell them the tricks of it, the other side of it, where we can get an adverse comment and all that. Thank you.
Rajsekaran, sir.
One more point, sir. We get a, see, all our PPS scheme members. And so whenever litigation occurs, we will get an advocate. But do one thing, you make what is the crime, you refer the textbook, give the points, copy it and then give to the advocate, study him, learn him, then only tell the advocate to go to the court.
Absolutely. That is one thing we've always slightly off track discussion here. That is, you say that I have an IMA PPS scheme, I have a Foxy PPS scheme, I have an XYZ scheme. Please don't go by what the advocate says. The point which Madam has said, you have to sit. For the particular case, Serena Madam herself said that I will sit for a day, get all the case sheet to me, I will sit and I will write and give it to you, whatever needs to be done. Now that is the sort of commitment which each one of us, now this Madam said for somebody else's case, not me, but that is
my own case I faced. My own case I faced, a placenta previa fetal death. And it was a consumer court. And then so I went and met the advocate. And
he doesn't know.
Yeah, he doesn't know. We have to learn him, teach him, take the photocopy of the textbook and mention the page also. And finally, actually, the court said, my client is not the husband, the patient. And so the court ordered to bring the patient. For my luck, the patient was another cesarean section done and she was in the hospital, she was not able to come. Because the court, this case is taken only after, it will come after 2 or 3 years. And for my luck, the patient was in the theater, in the post-operative ward, she was not able to come, the case cancelled.
So we have disposed the case in 20 minutes, but in actual practice, it may take 20 months or 20 years. It's a painfully long affair. So as far as possible, please avoid getting into such difficult situation by daily practices.
Subhash, Shaitas or Rajsekaran sir, can we ask one question? Yeah. Nowadays, the social media is so strong. How should a doctor react to such things? That is, a case goes wrong, immediately it starts popping up in online channels, TVs, etc., etc. How should the doctor respond to that?
I think you keep quiet, ignore that. I think it will die down after a week or so.
We shouldn't be responding.
Suppose you respond, then probably the problem will be aggravated.
We in Kerala, IMA has asked for a change in that hospital violence, that law now. Then when the new law comes, there is a provision for that also. That complaint against the social media harassment. Yeah.
There's one more suggestion that all of us should have the WHO surgical checklist. In that, it should be routinely followed during all the surgeries. And there's an article count checklist also. So that the nurse enters all the articles and have to check. And 3 people has to sign after the surgery. 3 people have to sign: the surgeon, the nurse assistant, and 1 assistant. So if we routinely follow